Coucou les amis. Today we are going to talk about reduction of risk potential. Starting from the top, we'll start with vital signs. There are 5 vital signs: blood pressure, temperature, heart rate, respiration rate, and pain. It's always recommended to start with the BP cuff. To put the BP cuffing on the patient, it takes time, and then you can proceed to put the temperature probe into the patient's mouth, because it's ideal to not let the patient talk when we take blood pressure. The normal range for blood pressure is from 90/60 millimole mercury to 120/80 millimole mercury. Temperature is from 36.5 Celsius to 37.3 Celsius. Heart rate 60 to 100 beats per minute. Respiration rate is 12 to 18 or 12 to 20. Pain is, of course, 0. Let's first dive into temperature. There are 5 ways to test for temperature. First, oral temperature. Rectal. If the patient has low temperature in oral or auxiliary, and it's golden test for to do rectal. Temporal and tympanic. Tympanic is in at the ear. And if it's fever, it's over or equal to 38 Celsius. That's called hyperthermia. If temperature is too low, it's called hypothermia, and it's below or equal to 35 Celsius. Now let's look at pulse. The normal range for pulse is 60 to 100 beats per minute. For newborn, 0 to 1 month, always take the apical pulse. You have to use the stethoscope to put on the apical pulse and listen to the apical pulse. And the normal range is 70 to 190 beats per minute. For adults, it's okay to take from the radial pulse. Let's look at the pulse's locations. Temporal, carotid at the neck, brachial at the elbow, radial at the wrist, femoral inside the thigh, popliteal behind the knee, posterior tibial behind the ankle, dorsalis pedis in between the big toe and the second toe. Strength. 0 is weak and absent. 1+ is ready and diminished. 2+ is normal. 3+ is bounding. Over 100 beats per minute is tachycardia. Less than 60 beats per minute is bradycardia. For the pain, we have several different ways to test pain. For normal circumstances, the patient is able to speak, and you ask them from 0 to 10, what is your pain? That is the numerical pain scale. The second one is Wong-Baker-Faces pain scale. You can show them the face, and usually it's ideal for dementia patients or patients who are unable to numerize their pain. You can show them the face. Then it's the Flag pain scale. We look at their face, their leg activity, cry, and consolability to have a score. Cries pain scale. Crying requires oxygen, increased vital sign, expression, sleeplessness, and we give a scale. On the side, I want to talk about patient-controlled analgesia. Patient should be the only one to push the PCA. That is for pain, usually given to patients post-procedure, post-surgery. Invasive monitoring. There are intracranial pressure, normally between 5 to 10, measured by implantable transducers. It's a probe inserted into the brain. If it's too high, the implement measures to decrease intracranial pressure and start seizure precaution. Then there's the pulmonary artery pressure. Normal range is from 8 to 20. It is measured by Doppler echo. If it's too high pulmonary artery hypertension, that will affect the right side of the heart and the artery going to the lungs. Here I showed a picture of this pulmonary artery pressure, how we measure it. From the jugular vein, we insert this yellow line measurement into the right of the heart, and through the right heart ventricular through the pulmonary artery, this line will go into the pulmonary artery and measure the pressure. Now we're going to talk about diagnostic imaging. There are many, and to summarize them, there are scopes, X-ray, CT, MRI, PET scan, scintigraphy, angiography, and ultrasound. First, scopes. In general, scopes we have to sedate patient with benzo plus adjuvant fentanyl. Pre-procedure nurse have to teach the patient to be NPO, nothing per mouth, plus denture removal, and you have to install 2 IV access. Post-procedure, teach the patient within 24 hours do not drive, and fever bleeding is possible. Soreness on the entry site is possible. And here are a summary table of whether or not to be NPO. For B scope, the scope that going into the bronchial for lungs. Pre-procedure, patient has to be NPO for 8 to 12 hours, and post-B scope, he or she has to be NPO for 2 hours. G scope, from mouth going into the stomach. Patient has to be NPO for 8 to 12 hours. And post-procedure, there's no need to be NPO, but you have to assess if the gag reflex is returned. NPO for C scope, the scope that goes from rectum into the colons. First 24 to 48 hours, the patient will be on clear liquid diet. And overnight, midnight, for about 8 hours, the patient will be NPO, plus he or she will take 1 gallon of Go Lightly. Go Lightly is a strong laxative. The patient does not need to finish all 4 liters of Go Lightly. It can be stopped if he or she is passing clear urine. Now let's dive into B scope. There are 2 complications. One is bronchospasm. The other one will be perforation. Usually B scope is used to take samples for biopsy. A little blood in the mucus is okay, is normal. G scope, from mouth to stomach. We use epinephrine on the bleeding site to vasoconstrict. And ERCP is a branch, another type of G scope. It's the same route from mouth to stomach, and ERCP has an extension that can go into the gallbladder duct to see if there's stone, or to remove the stone, or take a tissue from the bile duct. C scope, we have to watch out for perforation. It's going from the rectum into the colon. X-ray. X-ray is most ideal for bones. It has 2 positions, posterior, anterior, going from the back to front. It's a gold standard, and patient must be standing. It has clear visualization of the heart and the medial sternum. Medial sternum, mediastinum, is the space within the chest where heart is located. It wraps around the heart. Anterior posterior is from the front to back. Usually is given to patient who cannot stand. It is still suitable, and it asks the patient if the patient is too sick or unable to stand, it will be used, and it can be taken while patient is sitting up in bed. CT scan. It is used for muscle tendon, ligaments, detailed deep bone fracture. IV contrast, cold, is usually cold, and allergic to shellfish will not be allergic to contrast. Prior to CT scan, patient has to be NPO for more or equal to 2 to 4 hours. And we have to remind the patient, in order to protect kidneys, to stop metformin for 24 hours up to 48 hours after the procedure, 24 hours before the procedure, and 48 hours after the procedure. Make sure he or she drink a lot of water post-contrast use, and monitor urine output closely after CT if contrast is used. A CT scan is basically a donut-shaped machine to take multiple X-rays at various angles. It reminds me how Tesla is made, because before people had trouble coming up with a battery, and Elon Musk just put several batteries together, and that's the battery for Tesla. And CT scan is just putting multiple X-rays together and take the imaging at various angles. It is usually 5 to 10 minutes per set, and we have to ask the patient to remain still, and contrast may or may not be used. Next is MRI, non-invasive imaging method. It uses magnetic fields and radio waves to determine anatomy. It lasts 15 to 60 minutes, therefore it's not that efficient. It may show soft tissue or organ changes. It is great to see the brain, spinal cord, and nerves. Here I want to add one extra information about the spinal cord. One injury called coda equina. It is the compression of the spinal cord, leads to urinary retention and lower body paralysis. And for MRI, the contrast may or may not be used. Before MRI, the nurse has to make sure there's no metal objects in or on the patient, such as watches, jewelries, and assess for claustrophobia. Assess if patient has pacemaker. For old MRI, may deactivate the pacemaker. And for the newer MRI, it's safe for pacemakers. Contradictions. If the patient has old tattoos, it may contain lead in it. Or contraindication if the patient is agitated. Because MRI, you have to stay still. Next will be PET scan. It is used for cancer, to detect cancer. Patient has to be NPO for 4 to 6 hours, but he or she is able to drink water. And do CBGM prior to the test. Why? It's because PET scan, cancer cells love sugar. And during the PET scan, we are injecting a cold solution, a tracer, into the patient's body. And this tracer has high sugar in it. If wherever there's cancer cell, then the cells will multiply at the where when the tracer passes with high sugar, and the cancer cell will multiply, being nourished at wherever they are, and we're able to detect it. And if the patient has to breastfeed, post-procedure, she has to wait 24 hours. Scintigraphy, bone scans, or bone gallium. It is used for osteomyelitis, infection in the bone. It has lower radiation dose compared to CT scan. We also inject a radio tracer, which is cold, and in 2 days to see the marker of inflation in the bone. Angiography. Angiography is to detect the vessels in the heart. Patient has to be NPO for 8 hours. The contrast is hot. Patient has to be bed rest after the procedure for 4 to 6 hours. No driving for 2 days and no bath for 3 days. For 1 week, the patient cannot go swimming. No heavy housework. Do not do sports. Do not lift more than 10 pounds. If any bleeding is noted, apply pressure and go to ER. Ultrasound. Ultrasound can be performed at bedside. No radiation. Bladder has to be full because it helps to transport the sound wave and be able to see behind the bladder. It is used to produce image, for example, bladder, uterus, kidneys, abdomen, ovaries, testes, and vasculatures. It is a non-invasive imaging. No food or fluid prior if looking at GI system, digestive system. Make sure to drink water for full bladder if to scan pelvis or early pregnancy, that is less than 12 weeks. For more questions, please leave a comment below.